Hi guys, my name is Max Giesen. Today I'm going to talk to you about acupuncture and yoga and how they can be beneficial both to health conditions and also to everyday life. So I'm going to start off talking about the history of acupuncture. It's a branch of the traditional Chinese medicine, which has been around for thousands of years, over 3,000 years old. And the objective of acupuncture was in itself to balance energy, or as they called it, pardon me, they called it qi. And this practice was used on a numerous amount of health conditions, and it actually spread over to the United States when the railroad became popular, and a lot of Chinese immigrants came over to the United States, bringing a lot of their culture along with their medicines right around the 1800s to the U.S. It became popularized in the U.S. when Chinese and American relationships opened up in the 1970s during the Nixon era. And in 1997, the National Institute of Health actually acknowledged for the first time the benefit of acupuncture in pain relief along with pharmacological mediums. So conditions acupuncture can help. Primarily, it's focused on pain relief, so a lot of conditions such as arthritis, rheumatoid arthritis, chronic low back pain, migraines, osteoarthritis, hypertension is a bit of a unique case, and also more research is coming out about the effects of acupuncture in cardiovascular disease along with Parkinson's disease. Most of its success does lie, however, in pain relief, so it is used most often with those. So how can acupuncture help people with chronic pain? A study published on May 30th of 2010 revealed that acupuncture's analgesics or pain relief effects could be associated to triggering adenosine, a neuromodulator that inhibits pain receptors, and it actually targets adenosine beta 1 receptors by preventing them from binding to adenosine at the same time. So this is kind of one explanation or one school of thought brought about how acupuncture is able to help with pain relief. But yes, there is more research that needs to be done, more studies that do need to be conducted just to confirm this. This is a huge area of concern because of the opioid crisis. We see a lot of people today being prescribed very powerful opioids such as fentanyl, carfentanil, and others that could really have a substantial risk, such as death. And acupuncture is a relatively low risk. It is an invasive procedure that we will talk about, but it's a relatively low risk procedure that is able to provide some level of pain relief for some people. And a study at the University of Melbourne in Australia in 2017 found the greatest success in pain relief. The greatest success in the group that went through acupuncture compared to those who went through acupuncture and pharmacological medication, as well as just the pharmacological medication, proving how effective acupuncture could be in pain relief. And the fact that it's actually offered at a lot of emergency departments in Australia shows that it is growing its popularity is growing. So acupuncture in cardiovascular disease. Cardiovascular disease is the leading cause of death in the world. Hypertension has become one of the most prominent conditions associated with comorbidity, in that a lot of times people who suffer from hypertension often suffer from a lot of other cardiovascular disease or respiratory disease or etc. And a 2015 study at UC Irvine found that electric acupuncture at a specific body sites was associated with a significant drop in blood pressure. And I think the most interesting part of this study was how long these drops in blood pressure lasted. It lasted for over a month and a half, and that's after one treatment. So it kind of shows that if they're able to receive such effects from this non-invasive or this invasive but not that risky procedure, then why not give it a go just to kind of drop or attempt to fight the opioid crisis. So acupuncture versus dry needling. As a physical therapist, I see dry needling a lot. Or as a physical therapist student, I see a lot. I see it a lot at my work, where I work as a PT aide, and I've always wondered what the difference between dry needling and acupuncture is. It's similar in that there's needles going into the body, but their objectives and their objectives are a little different. Like I said again, acupuncture is focused on the flow of energy or chi through the body and centered around this idea of yin and yang and finding true balance. In that imbalance causes most diseases in the human body. Whereas dry needling is a much more physiological perspective. What it is trying to do is create these micro traumas around muscles, tight muscles, where the needles are inserted, and that's meant to promote an inflammatory response, promote blood flow to the area in an effort to kind of break up the knots in the muscles or break up any tension. The risks of dry needling, like I said, it is an invasive procedure. The needles can go into the body from anywhere from 2 to 5, 6 inches. So they can be relatively large needles, and it's still not a guaranteed success. So with any needles or with anything entering the human body, there's always a risk of infection, and that really is the biggest risk of acupuncture. There is, in the hands of an untrained individual, I mean, these acupuncture points may be close to vital organs, may be close to nerves, arteries, etc. So in the hands of an untrained individual, there's always a risk of organ damage, etc. And I just wanted to show you a quick table of the advantages and disadvantages that we find with acupuncture. And so a lot of it is that there's not expensive procedures that need to be done after this. I mean, this is it. It's needles. So there's no need for several like months and months of pharmacy expenses. It doesn't cause nausea, vomiting. There's no physiological depression. In fact, a lot of people say that they feel better. Whereas the disadvantage is it's possible that if people suffer from bleeding conditions, they could actually nick an artery, nick a vein, and that may cause problems with their inability to blood clot. And acupuncture may also interfere with surgical sites. It's a lot of people who go through acupuncture have prior injuries, so that's just something that we got to keep an eye on. My next complementary alternative medicine or treatment that I'd like to use is yoga. As a physical therapist, again, I think that activity, movement is something that could really benefit us all, whether we are injured or whether we are not. Yoga is becoming so much more prevalent in 2017. The use of yoga has actually jumped up by 5% in the last 5 years, which is quite impressive. And what's kind of surprising is that only 18% of patients report using yoga for a specific health condition. I think it can be a very beneficial treatment or exercise just because of what it's commonly used for. I mean, reducing stress, improving sleep, improving mood, for back pain, all sorts of pain, diabetes, stress, arthritis. These are all things that specific health conditions can give rise to. If you are dealing with a disease or pain, a lot of time it's easy to get depressed, to get stressed, to have impaired mood, etc. So I think yoga could be a very beneficial treatment. So the history of yoga, it began in ancient India over 2,000 years ago. And I think something has to be said about these two treatments, both acupuncture and yoga. They've been around for thousands of years, and I understand in complementary alternative medicine, you have to be clear to look at evidence-based research. However, it's hard to deny at the same time the thousands of years of anecdotal evidence, and this medicine and treatment is still here. It's hard to turn away from that. So, but at the same time, it's hard to also just accept it for what it is. So I do think that more treatment for all sorts of alternative medicines is needed, and objectified studies would be ideal. But anyway, yoga comes from the Sanskrit term to unite, and they mean to unite your body, your perception, your consciousness, your thoughts. and essentially kind of provide that same balance that acupuncture was looking to obtain. It's presently a very popular health trend, giving people both an ability to have activity as well as meditation, and this kind of positively affects their lives. So, diabetes is a glucose imbalance in the bloodstream. A lot of people hear these two types of diabetes, both insulin deficiency, which means that the pancreas isn't able to produce insulin. That's type 1, and type 2 insulin resistance. That's over a lifetime. It develops where there's a lot of glucose in the bloodstream and there's a downregulation in insulin receptors, and you start seeing that insulin resistance. For both of these, inflammation plays an enormous role. There's a family of cytokines as well as tissue necrosis factor that is associated with this insulin deficiency as well as resistance. Type 2 diabetes can occur due to chronic poor eating habits that result in a backup of insulin resistance and downregulation of insulin receptors, as I said. And you can see that this often happens when people are overeating, when they overstimulate their insulin receptors and there's just a lot of glucose in the bloodstream. They don't need as many insulin receptors to bring glucose into the cells. This is propagated by people who are not very active. And so that's why activities such as yoga and other exercises, it depletes your glycogen reserves in your muscles, and that depleted glycogen reserves, it kind of stimulates the body to produce more of these receptors to kind of fight against what that type 2 diabetes is doing. So yoga was also shown to reduce inflammation factors such as interleukin 6, and it's responsible for a huge amount of inflammation for both forms of diabetes. So that's kind of a physiological effect of yoga that's able to counteract not only the diagnosis of diabetes, but also the prevalence. So beyond a treatment, yoga is able to do a lot to healthy people as well. This is primarily in terms of a mental health standpoint. So it allows for good exercise and activity along with breath control. So you're moving your body around, you are able to stimulate your muscles, and it forces the body to hold these postures that are sometimes a little awkward, and it kind of creates a puzzle in their head. So in an interesting documentary I watched about the origins of yoga, there's an assistant professor at Harvard called Satbir Khalsa who mentions yoga's ability to test our brain and to create resiliency and to create this kind of problem-solving ability of our brain. And this leads to a bunch of responses, both mentally and physically. And we've seen he conducted an experiment on adolescents in Boston, and how taking yoga over PE it resulted in a decreased sense of stress, in improvements in anger and impulse control, and also a promoted sense of resilience, which are all things that we should strive for, and that they can all be very beneficial beyond just yoga. So risks associated with yoga, again, acupuncture and yoga, they have limited risks. I would say yoga has less of a risk of acupuncture, or I would say acupuncture has less of a risk of yoga. Pardon me. And that's just because it's not an invasive procedure. It's activity. So a lot of the risks lie within knowing your own ability. So people who suffer from spinal conditions or past injuries, they should be careful doing positions that put those joints or those muscles in compromising positions. For elderly people do yoga, it's becoming very prominent in nursing homes, yoga is. Just there's a higher risk of falling. People who suffer from spinal cord disease or spinal conditions, be careful holding headstands or doing various spinal manipulations. These are all risks. These are all risks of yoga. However, these are all very low risks, assuming that you know your abilities. So thank you very much for listening. Here are my references.